Welcome to Dr. Kannan Pugazhendi's channel. So what is a joint? A joint is a site of articulation of two or more bones. So that's a site where they meet. Most of the joints that we know are movable, and there are joints that are immovable or partially movable. But we don't bother about them, we bother only about the movable joints and believe that is the only joint available in the body. So you realize that there are other joints too. So the commonest joints that we feel that our hand, that has become an extension into the external world of this brain, is the most important part of the body to explore. So when we want to explore, if these joints are painful or in agony, early morning stiffness, oh my God, that's not what I want. So I have to put my hand into the hot water every time when I get up, and so my hands can be better. So these are happening to people who do not have any other major issue, but got suddenly into a change into the system where their own body forces are acting against them, like rheumatoid arthritis, and sometimes the wear and tear of the joints due to the articular cartilage that is being lost. These are technical terms which you find. What is this articular cartilage? It's like a sponge that is supposed to absorb the fluid that is there in the joint and send it into the bone when you get to be relaxed, and send it into the joint when you are loaded. So the sponge squeezes and sends the fluid this way into the joint space when you are going to be standing. When you sit down, when the pressure is lost, then the fluid is taken into the bone, so it can be exchanged for a new one and sent back. So the synovial membranes that are around secreting this fluid, these are the synovial joints. That is, there is a joint and there is a space and there is a fluid filled in it. So that's where our whole problem starts. We are not bothered so much about the other joints. In all these, the joints that get into trouble, not the immovable ones which are formed between two bones or formed within cartilage and a bone. Most of the time it is a joint where we have a fluid formed. There are two different concepts that we are going to understand. One is a normal bridge. The other is a suspension bridge. So the suspension bridge, I'd call it as a quantum physics, and the normal bridge as a Newtonian physics. So it's about understanding that this normal bridge has certain things to be bothered about, whereas a suspension bridge has a different requirement. Whenever we are going to be having a suspension issue above this can go and hit what is below. So we are bothered about maintaining the suspension by taking care of the muscles above the suspended part. So that means it requires muscular strength. So all the joints that are large, especially the knee joint, we are finding as a major reason for people to have pain. So we would give you these support systems which can avoid until unless they are destroyed beyond a certain point, where a knee replacement is always a Supreme Court appeal. So I would like to suggest where you don't even reach the police station. You should be able to avoid even all these things and manage this very well without this intervention of meeting a surgical intervention, which means it's going to be your original parts are being duplicated. You can avoid it. Do you think you would like to know about it? Yeah. So when we go into the water, when we walk inside a water, your weight is reduced by 90%. When there is severe pain and they can't resolve very easily, we take them into the water and ensure the joint has enough time to recover. Where inside the water, since your weight is 90% less, if you are 100 kg outside, inside you are 10 kg. So you can imagine anybody weighing 60 and all is only 6 kg. So the muscle mass is sufficient to get it suspended comfortably. And all these people, when they walk into the pool, will immediately say, wow, I find this is fantastic. I never knew I can walk so much. And this is possible if you go to moon or go down into the pool. So if you walk inside a pool with water up to your chest, it's comfortable to lose about 90% of body weight through buoyancy. So this can be done at least every day for a month to avoid these changes catching up with you. And if you do that for a month, you would have recovered phenomenally high and started your exercises to strengthen the muscles outside the joint, above and below. So in the case of the large joints, it is possible to a large extent to prevent if you catch them prematurely and ensure that these aqua therapy, as we call as water therapy, in which you move into the water, go into the mother and find that you can get back your joint rejuvenated. The other, the strength training, to make sure the suspension bridge works optimally. So it is possible for us to avoid a surgical intervention provided you are caught them early and ensured that these people can continue to exercise. Only one thing, you can definitely find the option of a surgery which is a one-time, you're going to get it done and after that there's no issue. It's a common impression. But after that also you have to work on the muscle mass. So you need to come back to these exercises and ensure that the muscle mass is maintained to keep this suspension unit comfortably happy. So you're no way that you're going to stop this exercise. So good news is you have to exercise. Bad news is you have to exercise. So if you understand, you can as well not see me or the orthopedic surgeon, provided you make the decision to exercise. Now, I have said there are diseases that are like rheumatoid arthritis, disease-based component. There are juvenile rheumatoid arthritis. Only in children they get this pain. They also find most of the diseases that have an autoimmune problem are related to the stress that they go through when they are young. And if we go back into details, you find if we are able to make those changes, the disease does come, but doesn't bother them so much. So a lot of changes through the stress relief that can happen, either in the form of exercise or yoga. So there are various aspects of this arthritis in which only 40-50% of the people who have arthritic changes due to age and articular cartilage is what I spoken about. There's one more category that can help you is the pulsatron that I talked about last time. I'll come back to you and talk more about this pulsatron in another session. And I want to say bye to you by saying, now take the baby steps again towards an exercise mode inside the water, outside the water, depending on you already have pain and you want to take that out, or you want to avoid pain, you can be far away from there so that you don't meet us again. Vanakkam.